Magandang hapon po sa ating lahat. Magandang hapon po sa mga kasamahan natin na media partners dito po sa DOH Gym at sa mga kasamahan po natin na media partners sa Zoom at sa live po natin sa ating pong DOH platforms. For today's media forum, kasama po natin ang ating officer in charge of the Department of Health, Undersecretary Maria Rosario Singh-Vergere, and we will move forward sa ating pong question and answer part. The latest updates of the Department of Health will be sent through our regular media group. So please wait na lang po after the conduct of this media forum. And we will now go directly to the question of CNN Philippines. Carolyn Bongkin, please.
Good afternoon po. Pwede pong malaman kung ano po yung, isa raw po dun sa basis bakit in-approve yung voluntary wearing of mask outdoors ay dahil we are already 6% away from wall of immunity. May we know po how the government came up with this number po? May we have the figures? Thank you.
Yes, thank you and good afternoon to all of you and welcome to the DOH's Media Forum. During the press briefing, the Secretary Trixie mentioned about the 6% away from having a wall of immunity. She was pertaining to the primary series vaccination. So we all know right now that we already have 93.2% coverage. So nearly 6% na lang kailangan natin, we have 100%. And we all know that if we vaccinate primary series among our eligible population, 100%, we'll have that immunity for our population. But we also know that our immunity wanes. And with this immunity that is waning, we need to have first booster shots for our population. So the plan of action would be that napag-usapan with the President for the first 100 days, at least 30%. We need to be able to reach 30% of our eligible population. And pag tinignan natin, ngayon, nasa almost 24% na tayo nitong eligible population. We also need only 6% to reach that 30%. But there is this agreement between the President, between and among all of our national agencies that we will all help for us to improve our booster coverage to at least 30% pagdating ng October 8, and then we will progressively improve our coverage until we reach 50 to 70% by the end of the year.
Thank you so much, Yusek and Caroline, for your question. The question of Caroline is also similar to the question submitted by Nika Hanopol ng Vera Files. We will now move forward to the second question, and this is from Giselle Umbay, GMA News Online. Yusek, the question po is, Octa has suggested for the government to put in place a set of triggers for reimposing outdoor mask policy. Is DOH considering this po, and what could these triggers be?
Well, una-una, Giselle, gusto natin i-clarify that mask is still our default. When we say that mask is still our default, for any settings na pupuntahan natin, kapag alam natin na ang risk natin ay mataas, we still continue to wear our mask. Ngayon, ito pong optional mask outdoors, kapag alam natin lahat, and even the President knows about this, and the IATF discussed about this, na pag dumating tayo dun sa point na yung ating levels, no? We have our alert levels. Pag pumunta tayo dun sa tumataas ng healthcare utilization, tumataas ang severe and critical, tumataas ang deaths, definitely magtataas. So hindi na natin kailangan ng panibagong measures or triggers for us to be able to mandate and to order and to revise our policies for us to impose again itong mandate natin sa outdoor masking because we already have our alert level. So kapag dumating tayo sa point na tumataas na yung mga pinag-iingatan natin na indicators which are admissions in hospital, severe and critical cases and deaths, rightfully, the policy will be revised and it will be discussed within the IATF and also recommended to the President.
Thank you so much. clarification, and Giselle for your question. We have another question from Red Mendoza, and he's not here with us right now, Yusek, from Manila Times. The question po is, sabi ni Father Austriaco that masking is hurting our children. Any reaction to this, Yusek?
Thank you, Red. We miss you here. Ikaw ang regular namin na nandito lagi. But anyway, I think DOH thinks otherwise. Masking is protecting our children. Pag tinignan po natin, ang atin pong mga kabataan, sila po ay pumapasok na ngayon sa eskwelahan. So there is more interaction, there is more mobility. Pangalawa, pag tinignan natin sa ating mga kabataan, mababa pa po ang ating pagbabakuna. We are only at around 43% of our 5 to 11 years old who are now vaccinated with the primary series of vaccines. So having said that, yung mask po makakatulong, 'di ba? Ang sabi natin, ang risk level natin, there are these 6 parameters para masabi nating perfect tayo doon sa sinasabi nating risk prevention natin. Have your mask, if you have your vaccination, you have your boosters, meron tayong frequent hand washing, may good ventilation, hindi tayo pumupunta sa matataong lugar, perfect tayo. Pag tinanggal mo ang isa, dapat the rest will still be there in order for us to safeguard our children or even the entire population. So kapag tinignan mo natin, yung mask na yan doesn't hurt our children. It protects our children from infections. Kaya nga po ang rekomendasyon ng Department of Health, kahit na po optional na po ang mask wearing outdoors, still highly encourage our parents, the mothers, the fathers, yung mga legal guardians, ipag-mask pa rin po natin yung ating mga kabataan pagpapasok sila sa eskwelahan. These are simple sacrifices for us to further protect our children, especially when they go to school.
Okay. Thank you so much, Yusek and Red, for your question. We have TV5, JC Posico, please.
Hi, ma'am. Ma'am, yung Philippine Chamber of Commerce and Industry, they said that yung optional mask wearing shall not be limited outdoors but also indoors, saying that people are responsible enough when or not to wear face masks. Ano pong pananaw po ng DOH dito and how ready are we for indoor masking?
Thank you, JC. Unang-una, gusto ko lang pong sabihin na hindi natin kailangan magmadali sa mga ganitong mga pamantayan. Our protocols or our safeguards for us or the restrictions that we impose ay mga bagay o mga pamantayan o protocol na nakakaprotekta po sa atin lahat. If you would look back dun po sa mga pinagdaanan natin sa pandemyang ito pong pagmamask natin, paggagawa natin ng mga iba't ibang mga restrictions have saved us from a lot of deaths in the country and also have saved us from having our healthcare system to become overwhelmed. Kaya ang sinasabi mo natin, dinadahan-dahan po natin, pinag-aaralan natin maigi. Lahat po ng atin pong ipapatupad will be based on science, will be based on evidence, and the ultimate goal is for us to protect the health of our Filipino people. So yun pong mga rekomendasyon na kailangan may indoor removal of the mask already dahil it's the responsibility of each and every one. I agree, it is the responsibility of each and every one of us to assess our risk, na alam natin kung ano ang tama na pagsuot, alam natin kung kailan hindi isusuot ang mask. Pero hindi pa po napapanahon na sa indoor areas or sa indoor spaces kung saan lahat po ng ebidensya pinapakita na mas mataas ang probability ng pag-transmit ng infection kapag tayo nasa enclosed at indoor spaces. Yan po ay hindi pa mabibigyan ng rekomendasyon ng Department of Health sa ngayon. Malinaw po ang executive order ng ating presidente, number 3, na sinabi outdoor, optional, we still encourage, highly encourage for those vulnerable like senior citizens, those with comorbidities, transport sector, ating mga kabataan, pati na rin doon sa crowded areas, hindi muna po natin i-encourage na wala silang mask. Kailangan may mask sila. So we do this in phases. Sana po magtulungan tayo. I agree with the statement. Ito po, responsibilidad na po magkakaroon tayo ng ganitong mandato kung saan ipapatupad na ito pong mga lesser restrictions because government still has that mandate over the health of each and every Filipino.
Thank you so much, Yusek and JC, for your question. We will now move forward to the second round of question and ask Carolyn Bongkin to please ask the question.
Ma'am, just to clarify, yun po bang masking outdoors ng immunocompromised and senior citizens ay mandatory pa rin or highly recommended lang or ibig sabihin voluntary? And also, sabi po kahapon ni Secretary Trixie, maglalabas daw ng bagong MPHS guidelines. So, we'd like to ask, ano po yung mababago sa MPHS guidelines natin ngayon?
Thank you, Caroline. No? So unang-una, base po dun sa mismong statement ng IATF resolution at saka dun sa executive order na lumabas, para sa senior citizens, those with comorbidities, sila po ay highly encouraged to still wear the mask. So kapag sinabi natin na highly encouraged, dapat po yung ating monitoring among our local governments would be strengthened. Na meron pong silang enforcement team kung saan magpapaalala lagi no, sa ating mga nakakatanda, sa atin pong may mga sakit na kababayan, dun po sa public transport, dun po sa mga eskwelahan, na kailangan kapag sila po ay vulnerable, sila po ay nagmamask. So kailangan lamang po maipatupad ng maayos, they are highly encouraged. Babalik tayo ulit dun sa responsibilidad ng bawat isa at yung assessment ng risk ng bawat isa. Pag alam po natin nakakatanda tayo, alam po natin na meron tayong sakit, mag-mask na po tayo. We highly encourage this to happen. Ngayon, yung additional guidelines, of course, because there is an executive order, we need to align with the executive order. So yun pong ating guidelines for the minimum public health standards as stated in our Department of Health policies will be revised according to this executive order that has been issued.
Okay. So we will be asking additional questions po. Yusek submitted sa ating pong media group from John Garner. The question po, Yusek, is kamusta po ang first day ng implementation ng voluntary wearing of masks in our outdoor setting?
Yes, no? So the first day of implementation, nung pinalabas ng executive order, actually, in-announce pa lang natin to, ang dami ng local governments na nagtatanong sa atin kung pwede na nilang ipatupad. Yun namang ibang local governments, they wanted also that they would still stick no, to the existing restrictions na hindi pa rin sila papayag na walang mask ang mga tao. So, mixed ang reaksyon ng ating mga local governments. But yesterday, during the issuance of the EO, we saw, no, this is a personal observation. Wala pa po tayong report na nakukuha sa DILG. But based from this, nakita natin na marami pa rin po ang nakamask sa labas, no, sa kalye, dun po sa mga pinupuntahan nating public spaces. Though we have seen also that there are some people who were not wearing their mask already, especially yung malalapit sa bahay pag dumaan ka dun sa mga harap ng bahay nila o di kaya dun sa mga maluluwag na lugar. So hopefully, tuloy-tuloy po na maayos natin maipatupad kung saan magtatanggal, lagi nating tatandaan at ano po ba ang dapat nating maalala. Ngayon po, ang ating main message na kailan tayo pwedeng magtanggal ng mask. Dati po, ang main message natin, di ba, kailan tayo kailangan nakamask. Ngayon, ipapaulit-ulit po natin para maintindihan ng ating mga kababayan, kailan tayo pwede na magtanggal ng mask. And that is something that all of us Filipinos should do kapag tayo ay nasa outdoors.
Okay. Thank you so much, Yusek and John Garner, for your question. Last question submitted by our media partners in our Google form. From John Garner, again, Yusek Daily Preview. Any reaction po sa sinabi po ng ex-NTF Special Advisor to the Department of Health yielded to the IATF but pushes for wearing of masks indoors and outdoors?
Yes, no? So unang-una, gusto ko lang sabihin, lahat naman po tayo are entitled to our opinion. Lahat po tayo maaring makapagsabi ng kanilang mga pananaw ukol sa mga nangyayari. But one thing I can tell you, no, isa lang po ang sasabihin ng Department of Health. Tayo po ay kasama sa IATF and we share that. Tayo po sa lahat ng desisyon naman na atin pong ginagawa at sinasagawa, ito po ay base sa ebidensya at sa science. Ngayon po, ito pong paglilift ng mask in outdoors, yung pong naging usapan at agreement, it doesn't mean that DOH yielded. It meant that DOH agreed and discussed with the other sectors of government. The primary objective of government is to open up sectors. So ito pong adhikain ng ating gobyerno ay kasama po ang Department of Health sa national government ng mga ahensya. Hindi po natin nag-yield para makompromiso ang kalusugan ng bawat isa. Ito po, shinik lang natin at para makita natin na ang talagang importante ngayon would be for us to protect the most vulnerable among our population. So kung titignan natin yung resolution, hindi po nawala yung health agenda dyan. We were able to position that this lifting of outdoor masking will only be done among low-risk individuals and among low-risk settings. Kaya po may ganung kolatilya. So that doesn't mean na nag-yield ang DOH, and I don't understand kung ano po yung blood in our hands because the position of DOH is based on science still, and we are going to back up this position naman po by through the coordination with other local governments, with our national government agencies, na patuloy po nating i-monitor ang ating sitwasyon, patuloy po nating hihikayatin ang ating mga kababayan kung ano po yung nararapat based on their risk level.
Thank you so much, Yusek. We only have remaining 4 live questions po from our partners here at the DOH gym. May we ask Rafi Bosano for your question, please?
Hi, ma'am. Tanong lang po, when you met with the President in your meetings with the IATF, napag-usapan na rin po ba doon yung redefinition of the term fully vaccinated or up-to-date? Kasi mukhang nagkakaroon po ng confusion sa messaging pagdating dun sa term na yun. Ang sinasabi ng iba, fully vaccinated, so hindi na kailangan mag-booster, and yet we're also encouraging the public to get boosted because the immunity wanes. So baka kailangan lang po siguro ma-redefine na yung term or iba na yung gamitin?
Yes, thank you, Rafi. No? So unang-una, I agree with you that there is this parang confusion between the terms. Kasi pag sinabi natin fully vaccinated, dalawang doses lang yung primary series. And but we still say that the immunity has waned, therefore we need boosters. Kaya kailangan i-redefine. And as we have said, we have already recommended this to the President. And the President advised us na wag muna because it's going to cause more confusion, especially now that marami na tayong polisiyang pinapalabas. Sabi niya, let's intensify our efforts to improve vaccination on the ground. Baka mas mahikayat pa rin natin sila by doing the other incentive and disincentive scheme. So when we did our IATF meeting last week, and we have agreed about this masking outdoors to become optional, ang isa sa hiling namin sa mga iba't ibang ahensya ng gobyerno, tulungan nyo kami. Magpatupad kayo ng mga polisiya that will help our vaccination efforts. And this will include interventions for incentives, interventions for disincentives. At kasama na dyan sa aming mga panukala would be, halimbawa sa mga turista, sa mga nagpupunta sa mga local tourist destinations, baka sakali, pwede, nahihingan natin sila nung card nila na may booster dose sila para sila makarating sa ibang lugar. Maaari rin magbigay ng perks ang ating Department of Tourism kung sino yung boosted, may extra perks sila pag pumunta sila sa mga lugar na ating tourist spots. Also, syempre, para sa ating ibang ahensya, katulad sa transport sector, maaaring magkaroon ng additional incentive din ng ating mga na-boosted na individuals in terms of the public transport. So ito po yung ating munang ginagawa. This is a phase. Tinitignan natin if this will eventually improve our coverage. So hindi muna natin pupuntahan yung redefinition. Pinag-aaralan pa rin pong maigi yan. Pero one thing I can tell you would be whether it is redefined or not, as long as we will implement in a whole of society approach, I think we can be able to improve this coverage in the coming months.
Thank you so much, Yusek and Rafi, for your question. May we ask JP? Yes, please.
Hello po.
Yusek, kumakalat po sa social media and nagte-trend po yung kidney for iPhone memes. Ano po bang masasabi dito ng DOH given na yung selling of organs at yung kidney ay prohibited sa Pilipinas?
Okay, is this about selling organs? Okay. Sige, matagal na nating gustong masupil, ito at ma-regulate natin itong pagbebenta ng ating mga organs. So, tayo po ay nagpalabas, I think, a month ago ng isang social media card at saka PR regarding this matter. Kasi we had been monitoring na meron pa rin pong mga tao na nagkakaroon ng mga ganitong adhikain, no? Siguro in order to earn money at gusto rin nila na makadagdag dun sa kanilang panggastos. Pero gusto ko lang ipaalala sa ating mga kababayan, huwag niyo pong gagawin na pumapasok kayo dun sa mga grupo na nagsisell o nagbebenta ng kanilang mga lamang loob ang tawag, no, or yung organs ng ating katawan. Tandaan po natin, yung mga organs ng ating katawan, kailangan po natin para mamuhay tayo na malusog. And though that people would always say, and some of the medical people will say na kahit isang kidney, mabubuhay ka naman. Kaya ang iba, akala nila, okay, ibigay ko na lang yung isa ko. Pero that is not the case. Because once your kidney is removed, meron din yung kaakibat na risk for you. You go through an operation para tanggalin. Pagkatapos, may iniinom ka na rin na gamot for you to maintain para na poproseso at naiaayos ang katawan mo because you removed one of your kidneys. So meron din pong mga disadvantages kapag tayo ay magbibigay ng isa pa nating bato o yung kidney na tinatawag natin. So ang pakiusap ko lang po sa ating mga kababayan, kayo po ay kumonsulta sa ating mga espesyalista bago po kayo magdesisyon na papasok kayo sa mga ganitong transaksyon. Pangalawa, meron po tayong batas dito sa ating bansa na ang tinatanggap lamang po talaga para maging organ donor would be our relatives, no? Yung mga living deceased relatives. So ito po yung nasa batas natin sa bansa. So ito pong mga pinapasukan nyo talagang transaksyon, illegal po yan because they would maybe pretend na ilalagay sa papeles na kayo'y kamag-anak, kayo po ay ganito, baka kayo po ay makulong pa dyan po sa mga transaksyon na ginagawa nyo. So we will try to monitor this specific circulating mga paalala, no? Itong mga sinasabing mga nagbebenta ng mga organs nila at papatignan natin din sa PNP at saka sa NBI para po maimbestigahan natin at mahuli natin kung sino po ang nagpapalabas nito.
Thank you so much, Yusek, for the very comprehensive answer, and JP for your question. May we ask Mads Villar, please?
Hi, Yusek. Yusek, bali, tatlo po yung question ko. Yung una, yung sa Special Vaccination Week, meron na po ba tayong coordination sa other agencies like yung DOLE para sa mga empleyado na halimbawa absent sa trabaho para magpabakuna on that day? And also, ilang percent po ng cases yung kailangan para itaas yung alert level, yung binabanggit nyo po kanina, at para maibalik po yung mandatory face mask policy. And also, kung may update na po doon sa study, doon sa pagbabakuna po sa mga below 5 years old po. Thank you.
So,
First question is about
Special vaccination.
Special
okay. Yung special vaccination days, dati pa tayo may coordination with other agencies. So kung mapapansin nyo po, even hindi pa tayo dumadating dun sa September 26, ang bawat regions natin sa country, they had been going around the different workplaces already. Nakikita natin maigi yan dito sa NCR, kung saan meron talagang pag-ikot sa ating mga workplaces, sa mga BPO industry, para po masuyod natin yung mga workers natin. Now, in terms of coordinating, kung pwede silang mag-leave, kung pwede silang hindi payagan sila during office hours. We are coordinating with the Office of the President. During the last time that we had our National Special Vaccination Day, nagkaroon po ng parang announcement from the Office of the President na magiging special na working na non-working, no, para dun sa mga workers natin para papayagan sila kung sakaling pumunta dun sa bakunahan kahit oras ng kanilang trabaho. So we will be coordinating and also with the Department of Labor and Employment para maipatupad natin ito na maayos. Pangatlo, for the less than 5 years old na bakuna, patuloy pa rin pong pinag-aaralan ito ng ating mga eksperto. Although nababalitaan na natin at nababasa natin sa ibang bansa ngayon that they have already evidences, nag-uumpisa sila, dito po it will go through the process again para po makapagpatupad tayo ng ganitong bakunahan.
Thank you so much.
Yusek, sorry. Yung sa alert, ma'am, kailan po, ilang percent yung kailangan para itaas yung alert level and ibalik yung mask mandate policy?
Actually, this EO is not tied to our alert level system. That's something to be clear. No? So, kahit na meron tayong alert level 2 na mga areas ngayon, they can still implement the optional mask mandate outdoors. Ang sinasabi natin kanina, hindi na natin kailangan ng mga bagong triggers. Meron po tayo ng mga pamantayan through our alert level system na alam natin na kapag dumating na tayo sa alert level 3, for example, ang alert level 3 po, kapag ang inyong healthcare utilization sa inyong lugar, nagmo-more than 50% to 70% na, you're reaching your moderate to high risk already. That's already a trigger for us. And that is something that we do regularly and monitor. And that is part of our alert level system. But it is not tied to the implementation of the optional mask mandate outdoor. So pag dumating siguro ang isang lugar, dalawang lugar, nagte-trend na tayo na nag-alert level 3 na ang maraming lugar. Of course, that's a trigger for government to check again our policy and try to revise it kung kinakailangan.
Okay, thank you so much, Yusek and Mads, for your questions. Yusek, we have 3 more questions from Mark Salazar, GMA News. Please.
Hi, Yusek, ma'am. 2 different questions lang po, ma'am. Yung una po, yung if the primary series waning or had waned already is already science, tama ho ba sabihin na then we are actually 24% immune pa lang dahil yun pa lang ang nagpo-booster kung nag-wane na yung 93%. So, paano po natin yun i-explain sa tao na ito ang situation and then we relax the wearing of the mask outside with that data? That's the first question, ma'am. And the second question is, tinatanong ng punong iba kung kailan daw po ninyo papayagan na ang general population na mag-second booster. Kasi there are those naman who appreciate really the importance of booster and they want the second dose, only they're not qualified because they belong in the general population. Ano po yung parameters that will allow the general population to get the second booster? Thank you po.
Yes, thank you. Thank you, Mark. So unang-una, yung 93% coverage natin among eligible population and then we only have 24% for our first boosters. Tama ka na sinasabi that immunity wanes. Tama ka rin na sinasabi that for now, because immunity wanes, we only have 24% of our population who are immune completely. Kasi kapag tinignan natin ang mga ebidensya, your first and second doses still gives you that protection, although it has waned. Hindi ka binaba sa zero nung primary dose, primary series mo. Walang ebidensya na nagsabi na back to zero ka. Ang ebidensya, bumaba. So tayo, para mas maitaas natin siya uli, kailangan i-boost natin yung immune system mo para tumaas siya uli to around 80 to 85 protection against severe and critical infections. So ngayon, pag may primary series ka, meron ka pa rin protection. Pero yung protection na dapat makukuha mo from your vaccines, which is around 80 to 85%, bumaba na yan ng gusto. Kaya kailangan mong i-boost ang immune system mo. So if we say that we have 24% boosted, they are completely, no, and they have against the virus. As compared to those who only got their primary series, the first and second, na yung kanilang meron ngang protection but it is not adequate already that can ensure to you na protektado ka na mas mataas sa severe and critical infections. For the second question would be the second boosters. Alam niyo po, we appreciate na yung mga tao na talagang naniniwala po sa bakuna at saka talagang gustong-gusto pa rin pong magpabakuna, especially the second booster dose. But let me tell you again that the DOH recommends based on science and evidence. And right now, the science for these second boosters is not that complete for us to say na bibigyan kayo ng adequate benefit the general population of the second boosters. Kaya po, hindi mairekomenda pa rin ng Department of Health. Tayo lahat dito, as soon as evidence is there and we can justify the action, we will immediately do that. Pero tayo sa gobyerno, kailangan po kasi pinag-aaralan natin lahat. No? The decision should be based on evidence. And currently, the evidence is not there yet for us to recommend further that the general population will have their second boosters. Yung first booster shots po ng lahat ng nakatanggap nito, that would still protect you and continuously protects you from severe and critical hanggang 80%, and that we can assure.
Thank you so much, Yusek. And Mark, for your question. Last two questions na lang po, Yusek, from Marco. It's SMA9.
Hi, Yusek. Good afternoon. Yusek, ano yung bago nating projection sa ating COVID-19 cases, especially ngayong Kapaskuhan, kasabay ng pagtanggal po ng face mask mandate? Thank you.
Yes, Margot. No? So, kakakalabas lang ng polisiya. So, ngayon, yung mga eksperto natin, ginagawa pa uli. Nakasama na yung assumption that we are going to lift or have this optional mask mandate outdoors. So, sa ngayon, ang atin pa ring projection would be the latest autumn projection last September 2. Kung saan sinabi ng latest autumn projection, yung kaso based on increased or mas mataas na mobility because of the opening of schools, mas mataas na interaction between and among students and also their parents waiting for them, yun pong continuous na slow uptake ng ating boosters and yun atin pong minimum public health standards na nabawasan na by as much as 20%, this will give you around 1,000 cases in NCR to around 8,000 cases in NCR pagdating po ng October of this year. Again, let me remind everybody, these are assumptions, these are projections based on scientific assumptions. So kapag may nababago po dun sa mga assumptions na meron tayo para sa projection, ito po ay maaring hindi mangyari. So this is not cast in stone, this is just used for us to prepare, used for us to plan, and used for us to guide our people.
Thank you so much, Yusek and Margot, for your question. Final question po is from Carolyn O'Kane, CNN Philippines.
Ma'am, at what point po will DOH consider the voluntary wearing of mask indoors? Ang sabi po kasi ni Dr. Solante, baka mas accurate din daw po dapat na basis yung booster coverage when it comes to looking at the wall of immunity. And just a quick follow-up lang po dun sa tanong ni Mark kanina. If our immunity from the primary series is waning or already waned, is it still accurate to say that we're 6% away from the wall of immunity? Thank you.
Thank you. Unang-una, kaya nga pinapaliwanag ko kay Mark no, na aside from the primary series, kailangan natin booster kasi nag-wane ng immunity. So we cannot term and we cannot say that our goal right now is just to have 100% of our primary series vaccinations to reach that wall of immunity. The actual wall of immunity that we are aiming for would be for us to improve our booster shots because we know that this additional dose for each and every Filipino who is eligible would up our immunity to around 80 to 85 against severe and critical. So having said that, ang kailangan po natin, kaya natin ginagawa no, for us to be able to us to have this wall of immunity is to improve our booster coverage to at least 30% by October, to at least 50 to 70% hopefully pagdating po ng dulo ng taon. Ngayon, nung nag-usap po ang IATF and the recommendations for lifting of indoor masking was raised, the DOH recommended na pag-aralan muna natin ito. Let's do it in phases. Tignan natin. Kasi yung condition natin for booster coverage, this is something of a safeguard for each and every Filipino. Katulad ng sabi natin dun sa risk levels natin, 6 out of 6, kapag yan ay meron ka, you're perfect. At yung chances mo of getting infected, napakababa. Tanggalin mo ang isa dyan, bumababa yung protection mo. So if you remove your mask, kailangan may safeguard ka na maiwan. And that would be your vaccination. So kailangan, pag dumating tayo dun sa punto ng pag-aaral na nakita na natin na tumataas na yung level ng pagbabakuna sa ating bansa for first boosters, nakikita rin natin stable na yung ating mga kaso, hindi na tayo masyado nagkakaroon ng severe and critical, walang masyado namamatay, hospitals are not full, and then siguro dadating tayo dun sa point, Caroline, that we can already recommend this trial, pilot study for specific areas na pwede nating tignan kung maaari na nating tanggalin ang mask indoors optional for these areas that we will be identifying. And that is what we have agreed on in the IATF with
Thank you so much, Yusek. Your final remarks and reminders to the public.
Yes, maraming salamat po sa inyo lahat. Of course, thank you to our media partners na patuloy pong tumutulong sa kagawaran ng kalusugan sa pagpapakalap ng tamang impormasyon po sa ating mga kababayan. Gusto ko lang pong ulitin ulit na ito pong optional use of mask outdoors ay doon lamang po sa mga low-risk settings. Ibig sabihin, hindi matao, hindi masikip, maayos po ang daloy ng hangin. At maaari rin, hindi rin, ito lang pwede sa low-risk individuals. Ibig sabihin, yun pong ating mga nakakatanda, yun pong ating may mga comorbidities, yun pong ating mga pumupunta sa transport sector, sumasakay po sa public transportation, kahit sa pila lang. At saka yun pong ating mga kabataan na pumapasok sa eskwelahan, we still highly encourage for all of you to wear mask. Tandaan po natin ngayon ang ating pong responsibilidad sa ating sarili, pati na rin sa ating pamilya at komunidad, na yung risk level po natin ay lagi natin i-assess. Meron po tayong mga iba't ibang layers of protection at kung tatanggalin ng isa dun sa 6 na layer of protection, kailangan siguraduhin natin na yung ating risk level ay hindi masyado mababawasan. So pag tinanggal ang mask outdoors, siguraduhin bakunado kayo. Siguraduhin nyo ang pupuntahan nyo ay hindi matao. Siguraduhin nyo maayos po ang daloy ng hangin dun sa pupuntahan nyo. So this is something that we can do for ourselves and for our family to prevent us from getting infected. Ngayon po ang atin pong message na gusto nating iparating araw-araw sa inyo, mask will always be our default. Ibig sabihin, ang mask po, kapag alam natin na mataas ang risk natin, isusuot natin. So ang tatanungin natin lagi at bibigyang paalala ng kagawaran, kailan ba safe magtanggal ng mask? Bibigay mo natin yan, kailan ba talaga safe magtanggal? Safe magtanggal kapag ikaw ay hindi matanda, ikaw ay walang sakit or comorbidity, ikaw ay hindi sasakay ng pampublikong sasakyan, ikaw ay hindi papasok sa eskwelahan na kasama ang iyong mga classmates. At safe magtanggal kapag ikaw ay pupunta sa hindi mataong lugar at ikaw ay pupunta sa isang lugar na maayos ang daloy ng hangin. So laging iisipin, kailan ba safe magtanggal ng mask. Maraming salamat po and we will see you on Friday.
Thank you so much, Yusek, and thank you to all our media partners.